welcome to Greater Nashua Mental Health conversation on nicotine and vaping. My name is Sheila Considine Sweeney, and I'm the Director of Integrated Care and the Site Director for our ProHealth program. I'm so happy that we could all get together today. I'm surrounded by some of my favorite people who joined my team here at Integrated Care and ProHealth. I think we'll start by doing a quick introduction around our virtual meeting room. I'm just going to identify a person, and if you could do you share your name and what your role is, that would be great. The first person I see is Christine.
Thank you, Sheila. My name is Christine Govain, and I am the Integrated Care Counselor for Greater Nashua Mental Health. And I also work as the Wellness Specialist for the ProHealth Research Program.
Thank you. I'm so glad that you were able to join us today. Next I see is Michaela.
Hi, I'm Michaela Bears. I am the ProHealth Research Interviewer here for our Greater Nashua ProHealth site.
Thank you. And I see DT.
Good afternoon, everybody. DT Bruno here. I am a therapist with Greater Nashua Mental Health, and I am also a community health worker working with a specialized focus of deaf and hard of hearing population. Hope everybody's having a great day today.
So far, so good. And last but not least, Cheryl.
Hi, my name is Cheryl Sundberg, and I'm the Integrated Care Case Manager for our Integrate Department.
Thank you. Well, welcome everyone. I guess we should start and talk about, what is integrated care? And I guess because I oversee the department, I'll start by saying integrated care is whole person care. It's the treatment of behavioral health, primary care health issues, and substance use issues. And we're very lucky at Greater Nashua to have an integrated health clinic. We just celebrated our 3-year anniversary, so happy birthday to us. And thank you for everyone who has helped make it the success that it is. We have roughly 250 clients actively enrolled in integrated health. So I'm very proud of that. And as part of our integrated health services, we offer various health and wellness and incentive programs to our clients. And today, I'm hoping we can spend a little time talking about one of those areas, which is our focus on nicotine education and cessation efforts, and also vaping. And I'm lucky enough to be surrounded by a group of professionals that have some very specific areas of focus that make our team very well-rounded. So I guess one place that I would like to start has to do with what is ProHealth? ProHealth is a federal SAMHSA grant targeting health behavior change for transitional adults between the ages of 16 and 39. And it is a research and evaluation study, as well as a health behavior change program. And an important component of that program is Michaela, who is our research interviewer and who works collaboratively with Dartmouth Hitchcock to do our evaluation and our data work. So Michaela, can you provide us, or to the viewers watching this today, your relationship with Dartmouth and why your role is so vital in our efforts to look at integrated care and meeting the needs of transitional age adults?
Absolutely. So I meet with Dartmouth weekly, and I am able to provide updates from our site, but also get updates regarding any changes in how we collect data, or if there's any additional information that they're looking for. I can also clarify and share any issues that we might be having or barriers that we face. And I think this is just really important because I am able to help identify with the individuals that I'm working with the participants in the program, how we might be able to improve not only the services for them, but across the board for all of our participants. So being able to collect that information and bring it back to Dartmouth and share that is really important in making sure that the integrated care is just working well for all of our individuals and that we're able to tailor those services.
Awesome. Great. You're going to provide the data that's going to help us continue to do our good work post the grant. So thank you for that. And I guess I'm thinking this could be a question that could go to DT or to Cheryl, because your roles are so important as a community health worker and as a case manager. When you're thinking about the clients that you both serve, why is it important, or what would be the selling points to have someone come and join our integrated healthcare clinic? So either DT or Cheryl.
Cheryl, would you like to go ahead?
Sure. So, when we talk to clients, we want to make sure they understand it's the full wraparound care that we as providers can talk to their Greater Nashua providers and their Lamprey providers to make sure we're all on the same page and make sure they're all getting the best care possible. So that's really important for the clients to know, and I think they enjoy that. It's if they don't remember something, they can either reach out to myself or somebody on their treatment team to remember where their certain referral went to or where they have to get labs drawn and things like that. So I know the clients really enjoy that aspect of Integrate.
Great, thanks. So you actually can coordinate all of their services under one roof.
Right, exactly.
I wish my doctor's office would do something like that. So, DT, do you have thoughts on this?
Hi, Sheila. I absolutely support what Cheryl just said, and I want to second that. It's extremely beneficial when we have a holistic approach to healthcare, and that includes, and not limited to doctors, but a whole spectrum of specialists, case managers, colleagues on the team. It's extremely important that we work together. Some people might feel uncomfortable seeing us talk to each other, but it's about trust and developing that trust. Sometimes we bring information and resources to individuals and the community we're working with, and they find it's a more comfortable place to get that. It could be a church, it could be a senior center, it could be a center, any place that individuals interact. We can serve as a bridge to do that outreach. And again, it's not limited to just being in the office in our workplace.
Great. I have a follow-up question for you, DT, if that's okay. Your role as a community health worker is very unique, and in addition to you being a therapist, so you bring a really unique perspective to this role. When you think about population health and outreaching and educating the community, do you feel many clients in the community are struggling with tobacco use and vaping use and would benefit from these services? Are you seeing many clients impacted by their health's being impacted by smoking?
Sure, Sheila. As a CHW, I have the privilege of being able to interact with different ASL and deaf professionals and really get a feel of the community. I'm new to the state here, and so I'm not as familiar. So gathering that information from individuals, talking to my team about who's smoking. Some people have already quit using, and it was really common. And what we see is that quitting process can be very lonely journey for individuals. There's not a lot of available resources in ASL, American Sign Language, or support groups. There might not be any. Too often people quit on their own and go through that journey on their own. They may experience withdrawal symptoms without knowing what it is or what it means, or they are not successful in being able to stop using. And that is a frustrating thing to hear about. So providing linguistic and culturally competent resources is a huge, huge thing of what I do.
And we're really grateful to have you with us. And I am so excited that ProHealth was created with a specialized component, with your role in the work that you're doing, which kind of leads me over to the work that Christine does as our integrated care counselor and wellness clinician. She is responsible for delivering those behavior change interventions to help our clients not feel so isolated and so alone as they're possibly struggling with withdrawal symptoms, or you know just the isolation of trying to change behavior all on your own, with in a stressful situation, especially during the pandemic, where many of us are under so much stress now, which I can only imagine has been a struggle for those of us wanting to do, health and wellness change. So, Christine, help us understand, what do you do? How do we support someone who wants to get more information about their smoking habits or their vaping habits, and how do you help someone work through like the stages of change where they might look at moving into action?
Yes, and I'd like to build off of what DT had mentioned about the quitting process being very lonesome, and the withdrawal symptoms. And I know in our population in particular, withdrawal symptoms from lessening or quitting smoking can sometimes be confused with mental health symptoms increasing. So, as you said, Sheila, providing a lot of that just initial education to the clients if they are a smoker, whether or not they're ready to change, or they just want to know how their smoking habit or vaping habit is impacting their health. uh, Providing them information about I would say facts and myths about what is withdrawal symptoms and what is symptoms of mental health. And when it comes to withdrawal symptoms, that's something we can help with. We have medical professionals here that can assist with medication assistance to make that process more comfortable for them. We also have access to the nicotine replacement gums and lozenges and patches. And also, above all, I would say my role as the wellness specialist would be to meet with them either over the phone or in person or over telehealth for those one-on-one cessation sessions if they were ready to quit at that point. So not having to go it alone, not having to go cold turkey or have it be, an uncomfortable process, and helping them build some skills that they can universally apply across other things that they might be trying to overcome or change in their life. So it's really great opportunity for our clients who might have thought about quitting or even tried to quit in the past, but just didn't have those connections.
Wow. Uh, what a privilege to hear about the supports that are available to our clients. I'm looking at all of you today and the different roles and responsibilities you have in delivering these unique services. So it makes me start to think about, are we starting to see some positive movement? Are we starting to see success? Are there any success stories or positive messages that you want to include here today about the work that you're doing or about the behavior change that you're seeing? So I guess that's a free for all question. Would anyone like to share anything?
I would, if I may. So I think part of what I enjoy most is redefining success and what the people I work with think of success. So some of them might quit, some of them might cut down, some of them might just be taking steps towards quitting, but being able to work with them and give them the tools that they need to make those changes, but also knowing that if they have a slip up, that's okay. It's expected. This isn't an easy process. It's harder to quit than it is to never start. So, uh, I really give them all the props for their resilience and starting the next day saying, today I'm going to start as a non-smoker again, and I'm going to treat it as a new opportunity. So yes, I've had people successful in quitting. I have people who I'm still working with, and I'm really fortunate to work with these individuals because it's just such a positive experience all around.
So this is DT. And for those folks who are a little bit older, it's never too late to quit smoking. And it's also never too early, for the young folks to be prepared and with that preventative care as well. So that's why I think ProHealth, it's great to have, focused on that age, because, those, when you're young, that can make a huge impact on your life. So to get that preparation and get that information now, I think that's a great opportunity for young folks.
I agree. Thank you so much. Cheryl, you were a case manager for a super long time. I'm just curious, in your experience as a case manager, and I guess Michaela too, she was a previous case manager, did you see many of your clients struggling with nicotine and smoking or vaping? And how did you see it impact their journey?
Yeah, a lot of my clients that I worked with smoked often. It impacted their housing or their ability to pay rent and pay for groceries. Often they would prioritize their cigarettes over paying for their rent or their groceries. So I saw that a lot while working as a case manager.
Yeah, that must be really hard as a case manager when you're tasked with trying to help people, look at budgeting and managing their responsibilities and seeing this this entity that was really impacting it, and knowing now, there's treatments available, there's behavioral interventions available. So I feel very fortunate that we can offer this program to transitional age adults. I just want to say, talking about vaping. What is it? What is the prevalence in the population of transitional age youth that we work with in young adults, ages 16 to 39? And what is ProHealth trying to do to support education and cessation efforts? So we spoke a little bit earlier about nicotine education and cessation, and we're going to talk a little bit more now about vaping. It's really making a strong presence in our community, and it needs to be addressed. So Christine, can you help me explain to the community what is vaping? Why do young people like it? And why at a time did people actually think it was like a safer alternative to nicotine use? And now that thought process has kind of changed. So I'd love to hear what you think about this.
Yes, thank you. So vaping, it's sort of the big question mark. Like you said, it is so new, and at the beginning, people did see it as a pretty good step down from traditional cigarettes because they weren't inhaling the smoke that they would have from cigarettes. And really, some of the biggest dangers are that it's unregulated. So somebody might think that they're getting a vape cartridge that is safe to use, but it could really have a lot more harmful chemicals than they're thinking. And that's going into your body. And it's, the younger kids who aren't really supposed to be buying it or aren't old enough to be buying those products in the store are getting it from their friends. So as you know, as a parent, and that is concerning that they don't know what they're putting into their bodies. So I think that's probably one of the largest concerns in the medical community, and also people that care for these kids, or even adults that are buying vapes the traditional way. There are still metals that could be in there, and it's just so new, and the research isn't quite enough yet to see the long-term effects of vaping. Of course, not doing anything, not smoking, not vaping would be best. So we really, as a department here in integrated care, we work with them on building those skills to decrease both of those activities and increase their coping skills for managing when they have a craving to vape or smoke, or also connecting people with some outside resources. Teens, they might not want to pick up the phone and call a quit line, so there is some alternatives for them. They can text 855 891 9989 for support. They could also call that number. And there are some social media sites that they could use at saveyourbreath.newhampshire, both on Instagram and TikTok. So that really speaks their language. Teens, they want information, they want it now, they want it how they get so much, so much other information in their lives. So really thankful as a clinician to be able to direct them that way. And on top of our individual work that we do, because the vapes, even though they are supposed to be available for adults, they're really marketed towards kids, just like we saw cigarettes back in the day. They have great flavors, they look really cool, they're so small, and they are electronic. So that's the world our kids live in, is these really it looks like any other tech thing that they might be drawn to. So, that's part of the danger too, is how easy it is for them to pick up. But as we know with smoking, it's really hard to put back down.
It sure is. When I think of vapes, I remember the first time I saw a vape, I was like, what the heck is that? Because it didn't look like a cigarette. It didn't look like, a pipe or any other type of source of tobacco that I was used to. It was in a funky pen or a cartridge, or something that looked like, like a USB type device. Kids were going to school with them and using them in the bathrooms and the locker rooms, and no one knew what they were for a period of time. And now we have all these possible associated health risks with vaping. I think about, as a community health worker, DT, and as a therapist, because you have that dual role and dual understanding of our population. Uh, not only is it a health risk for their, primary health care issues, but, vapes are often used to abuse substances as well. We see marijuana use with vapes and, other illicit substances. Is it a challenge for you in the community to educate people about these dangers, but also not alienating them in the process? Because we know young people, they don't like to feel that they're being confronted or challenged about their behaviors. What is that balance that you as a community health worker have to have between educating someone, but also trying to engage them in the discussion of contemplating behavior change?
Thank you, Sheila. Really, it's not isolated to only the deaf population. I think it's very similar to the hearing population. A pack of cigarettes, it's cheaper than an hour of therapy, honestly, right? And so we've got a stigma we're dealing with. We've got lack of accessibility to resources. And so they're like, oh, I'm allowed to have this smoking, They don't understand the risks because the resources that are available are quite limited. One thing that I really hope is that those who are trying to quit, that they are not tasked with that by themselves. Like Christine said, we have the advertising industry trying to focus and pull these kids in, or those individuals. The FDA, the Drug Administration, they want to ban the methanol flavors, and that would be a first step, a really strong impact on the BIPOC community, because those flavors, right, that are targeting those individuals. And so there's many different parts and factors in that process, right? Who's making it, who's marketing it in society, how we're receiving it and talking about it. that when we talk about the deaf population, you know, it is difficult. Individuals are isolated and have a lack of access to resources, and I would say that is perhaps the biggest barrier that we're facing, is that lack of resources that are available to our community.
So I would say it's a privilege at Greater Nashua that we have this resource available to offer our clients. And for you being a statewide community health worker, that you can spread that messaging. And ProHealth is available in other areas of the state with two of our community partners. So hopefully we can make a difference. So thank you for the work that you are doing. And you know, Christine, you have a really tough job with these behavioral health interventions and engaging our clients. DT, did you have a hand up and you wanted to add something? And I moved too quick?
Sure. No, Sheila, really, I just wanted to agree with you that the more people that we can get involved and collaborate, different sites, agencies, communities, organizations, the more collaboration we have, the more part of the solution we can be. And I think the more energized people will be to become a part of that solution.
I definitely agree. And to continue on that collaboration note, Christine, you have peers in the community as well that are trying to do the similar work that you're doing with ProHealth. Do you see a benefit in being able to have that collaborative relationship with other ProHealth sites as you tackle these significant, you know, environmental and health issues?
Absolutely. I think sometimes when it comes to not only vaping and smoking, but substances and other things that are impacting the people that we serve, sometimes as clinicians we can feel like we're playing catch up with what these harmful things are that are happening in our community. So really having that network about what have you guys tried, what resources do you have, how can we get access to those for our own population, and just sharing the knowledge, like DT said, the more people across the state that we can have those joint efforts for helping our communities, whether it be targeting smoking or vaping, or just in general any health concerns or mental health. As a state, we haven't been immune to the effects of the pandemic and other things going on in the world. So we really need to come together to support the people of our state so that we can, move forward healthier together.
Absolutely. And I'm glad that you know, brought up the pandemic, because I do want to make sure our community is aware that we're able to provide services not only in person, but we have remote virtual services available. So the impact of the pandemic, we can still provide essential healthcare services, essential behavior change services. So, you know, thank you to Greater Nashua for making sure that we have the tools necessary to do our work. You know, and on that note, I need to thank my team again for the work that you do and joining together with me today to try to educate the community about what we're doing, and encouraging people to take their health concerns seriously, because we only have one body and we need to treat it well. So on that note, everyone, please stay well, and we'll talk again soon.